Welcome to a new edition of Tria Triumphs, real stories where our pharmacists improve the health of their patients, making happier, healthier members. The patient challenge for this edition of Tria Triumphs highlights some of the challenges of mental health therapies and the critical need for the expertise of a pharmacist. Before we meet our patient, let's talk about some of the variables when treating a patient exhibiting mental health symptoms. Oftentimes, when people are managing multiple health conditions, they can feel stressed, anxious, and depressed. It can become difficult to distinguish whether their symptoms are a result of a mental health condition or just the stress of managing their conditions and treatment plan. Tria Health pharmacists use standardized assessments to make this distinction and really understand if a person's mental health medication is effective in managing their mental health symptoms. Now, let's meet Courtney, a 43-year-old Tria Health member dealing with 7 medical conditions, including bipolar depression, and seeing 2 doctors for her treatment. She also takes a total of 9 prescriptions to help with her various conditions. During a comprehensive medication review with a Tria Health pharmacist, Courtney shared that she had a history of depression and had been taking an antidepressant. While assessing Courtney's depressive symptoms, the Tria pharmacist discovered that she was also taking a medication to treat a seizure disorder. Her antidepressant medication is not recommended in patients with a history of seizures, as it can increase the risk of having a repeat seizure. So the pharmacist recommended that Courtney switch her depression therapy. She began taking a new medication immediately, and by her follow-up appointment, Courtney's depression symptoms were still being well managed. As highlighted in this Tria Triumph, a pharmacist consultation can be an invaluable aid for a patient's mental health, especially when you consider that 25% of people with a mental health illness report an unmet need for treatment, and people with depression have a 40% higher risk of developing cardiovascular and metabolic diseases. Medication management is critically important when it comes to mental health. It is often considered the first line of defense in conjunction with therapy, and having a pharmacist who is a medication expert can be an invaluable patient resource. With Tria's pharmacist-first approach, customized care plans are based on individual needs. Working with your physician, a Tria pharmacist can recommend prescription changes or adjust therapy, or recommend non-pharmacological methods to help with symptom severity. Sleep, nutrition, and exercise are all vital factors in a patient's mental health outcome. And with a Tria pharmacist in your corner, patients like Courtney have an advocate on their side to get the medication right, so they don't have to face depression alone. Come back often to check out more triumphs with the help of our Tria Health pharmacists.